year or longer. Feedings should be initiated soon after birth unless medical condition precludes them. Mothers should be encouraged to nurse at each breast at each feeding, starting with the breast offered second and at the last feeding. They should also empty the first breast before offering the second to allow complete emptying of both breasts and therefore better milk production. Breastfeeding has documented short and long-term medical and developmental advantages. The success of breastfeeding, initiation, and continuation depends on multiple factors such as
Dok,
education,
4 o'clock kaya
breastfeeding,
tira
about
open, di ba?
breastfeeding, hospital breastfeeding
4
practices
kaya
and
tira open.
policies, routine and timely follow-up care, and family and societal support. So the benefits of breast milk for the baby. First is it is safe, sterile, and always available, with perfect nutrients also to fully sustain the growth and development of the baby from birth to 6 months. After 6 months, still a good source of nutrients when given with adequate complementary food. It is also easily digested and absorbed, efficiently used by the babies for the immature system. It contains antibodies and substances which protect the baby against infection. It also contains fats, DHA, which enhance brain development and intelligence of the baby. So we have here the selected beneficial properties of human milk compared with infant formula milk. So breast milk has secretory IgA. This is an anti-infective action. It has also lactoferrin, an immunomodulation, iron chelation, antimicrobial action, anti-adhesive, trophic for intestinal growth. It has also casein, oligosaccharides, cytokines. For the growth factors, it has epidermal growth factors, transforming growth factor, and nerve growth factor, which promotes neural growth. Some enzymes also, we have the PAF, glutathione peroxidase, and nucleotides for antibody responses to bacterial flora. So the absolute and relative contraindication to breastfeeding because of maternal health condition. So some conditions, we have the HIV or human T lymphotropic virus infection. So in United States, breastfeeding is contraindicated. In other settings or other country, health risks of not breastfeeding must be weighed against the risk of transmitting the virus to the infant. The common to the Philippines, we have the tuberculosis infection. Breastfeeding is contraindicated until completion of approximately 2 weeks of appropriate maternal therapy. Another is varicella zoster infection. Infants should not have direct contact to active lesions, and infants should receive immune globulin. Another is herpes simplex infection. Breastfeeding is contraindicated with active herpetic lesions of the breast. We have the cytomegalovirus may be found in milk of mothers who are CMV seropositive. Transmission through human milk causing symptomatic illness in term infant is uncommon. For the Hep B infection, infants routinely receive Hep B immune globulin and hepatitis B vaccine if mother is HB antigen positive. No delay in initiation of breastfeeding is required. For the hepatitis C infection, breastfeeding is not contraindicated. For the alcohol intake, the mother should limit the intake of alcohol less than 0.5 gram kilogram per day, or this is for a woman average weight. This is the equivalent of 2 cans of beer, 2 glasses of wine, or 2 ounces of liquor. Cigarette smoking is discouraged but is not contraindicated to breastfeeding. For the chemotherapy, breastfeeding is generally contraindicated. So the condition in for which milk may have protective effect, so it protects from diarrhea, otitis media, urinary tract infection, necrotizing enterocolitis, septicemia, infant botulism, insulin-dependent diabetes mellitus, celiac disease, Crohn's disease, childhood cancer, lymphoma, leukemia, recurrent otitis media, allergy, recurrent hospitalization, and infant mortality. So, 10 hospital practices to encourage and support breastfeeding. So, this was taken from Nelson's. The hospital must have a written breastfeeding policy that is routinely communicated to all healthcare staff. train all healthcare staff in the skills of necessary to implement this policy, inform all pregnant women about the benefits and management of breastfeeding, help women initiate breastfeeding within an hour of birth, show women how to breastfeed and how to maintain lactation even if they are separated from their newborns. Give newborns new food or drink other than breast milk unless medically indicated. Practice rooming in like we do in our hospital. Encourage breastfeeding on demand. Give no pacifiers. Foster the establishment of breastfeeding support groups. So, recommendation on breastfeeding management for healthy term infants. First is exclusive breastfeed for about 6 months, and we have also the peripartum policies, direct to skin contact, delay in routine procedures, delay in administration of intramuscular vitamin K, ensure 8 to 12 feedings at the breast every 24 hours, ensure formal evaluation and documentation of breastfeeding, give no supplements, avoid routine pacifier, and begin daily oral vitamin D drops. Third is all breastfeeding infants should be seen by a pediatrician within 48 to 72 hours after discharge from the hospital. So they are recommended for early follow-up. Mother and infant should sleep in proximity to each other to facilitate breastfeeding, and pacifier should be offered while placing infant in back to sleep, position no earlier than 3 to 4 weeks of age and after breastfeeding has been established. So make sure that breastfeeding has been established first. This was by the book lang, ma'am, for the Nelson. Pero in our hospital, we don't encourage that. So patterns of milk supply. On day 1, postpartum, there's some milk may be expressed, and day 2 to 4, lactogenesis or milk production increases. In day 5, milk is already present and noted fullness and leaking are felt. So in day 6 and onward, breast should feel empty after feeding. So advantages of breastfeeding, it's like more of for the mother. It promotes emotional bonding between mother and the baby. It protects the mother's health against cancer and early return to pre-pregnancy weight, and it give big financial family savings. For new mothers should be instructed about hunger cues, correct nipple latch, positioning of the infant on the breast, and feeding frequency. Discuss on the issues on infant feeding, elimination patterns, breast encouragement, breast care, and maternal nutrition should be taken by the mother. Follow-up appointment is needed within 24 to 48 hours after hospital discharge. So these are some issues about having breastfeeding. So mother would the most common is nipple pain. This is due to the poor infant positioning and improper latch. Are the most common causes of nipple pain. If problem persists and the infant refuses to feed, consideration need to be done to be given to nipple candidiasis. If present, the mother should be treated with an antifungal cream that is wiped on her breast, and the infant should have the treated with oral medication. Another issue is engorgement. It is the second stage of lactogenesis wherein physiologic fullness and the breast occurs. Breast may become engorged, firm, overfilled, and painful. The pattern of volume of milk production is adjusting to the infant's feeding schedule. That is why engorgement happens. It is also due to the incomplete removal of milk as a result of poor breastfeeding technique or infant illness can cause engorgement. So the remedies for this to reduce engorgement, breast should be softened prior to infant feeding with a combination of hot compresses and expression of milk. Between feedings, a supportive brush should be worn, cold compress applied, and oral or NSAIDs may be administered. Another issue is mastitis. Usually it happens in the second week of postpartum. It occurs in 2 to 3% of lactating women, usually unilateral breast. Signs and symptoms would be warmth, tenderness, edema, and erythema. Organisms, we have Staphylococcus aureus, Escherichia coli, Group A streptococcus, Haemophilus influenzae, Klebsiella pneumoniae, and Bacteroides species. So diagnosing a mastitis is because diagnosis is physical examination. So for the treatment, we could give the mother with oral antibiotics and analgesics, breastfeeding or emptying of the affected breast. Breast abscess is less common complication of the mastitis. When this happens, the mother needs an intravenous antibiotics, incision and drainage, along with temporary cessation of feeding from the breast. Another issue is inadequate milk intake. This happens usually in the first week of life. Causes of this is insufficient milk production, failure of established breastfeeding, health condition of the infant that prevent proper breast stimulation, and improper technique of breastfeeding. Another would be preterm. So symptoms would be we could observe with the baby that the baby is lethargic, delayed stools, decreased urine output, weight loss, and weight loss of more than 7% of birth weight, hypernatremic dehydration, inconsolable crying, and increased hunger. So we need to counsel the mother that she needs to breastfeed the units 8 to 12 times a day with minimum of 8 times per day. So another issue is jaundice. We have breastfeeding jaundice and breast milk jaundice. Breastfeeding jaundice it is due to insufficient milk intake during the first week of life. Breast milk jaundice is a different disorder that happens second to third week of life. This is due to the persistently high serum indirect bilirubin thriving healthy baby that becomes evident later than breastfeeding jaundice. So baby would need phototherapy. So how to breastfeed the baby? We have the correct breastfeeding techniques. The first is support the baby's head and the entire body throughout the feeding. The head, back, and hips should be facing the breast and aligned in a straight manner. Maintain the position of the baby in such a way he is face to face, chest to chest, and tummy to tummy with the mother. Support the breast with the hand of the opposite arm in a C fold position, thumb above and fingers under the breast. Next is stimulate the infant to open the mouth wide by stroking the corner of the baby's lips and check the chin touches the breast and the lower lip is turned outward. Next is ensure that the baby grasps the entire nipple plus 1 inch of the surrounding areola. Allow the baby to suck 15 to 30 minutes per breast to extract both foremilk and hindmilk. Empty the breast around 8 to 10 times or more a day to ensure adequate milk supply. So this is like similar to what I have said. So how for the breast milk expression and storage. In expressing breast milk by hand or by using a breast pump when breast milk supply is abundant and when the mother is planning to go back to work. They could store the expressed milk in sterile polypropylene containers properly labeled with the time of breast milk collection. So for the recommended breast milk storage period, for room temperature less than 25 degrees Celsius, they can store it for 4 hours. For room temperature more than 25 degrees Celsius, they can store it for 1 hour only. For refrigerator with temperature of 4 degrees Celsius, they can store it for 8 days. For freezer compartment of one door refrigerator, they can store it for 2 weeks. And for freezer compartment of a 2-door refrigerator, 3 months. And deep freezer, negative 20 degrees Celsius. You can store it for as long as 6 months.
So complementary feeding is the process of starting foods when breast milk alone is no longer sufficient to meet the needs of a growing infant and other food and liquid needed along with breast milk. The target age is 6 to 24 months, while breastfeeding is continued until 2 years and beyond. This fills in the nutrient gap of breast milk and train the infant on appropriate feeding skills necessary for healthy eating habits in adult life. Complementary foods are solid and liquid foods other than breast milk or formula, which are also called weaning foods. So there are four important features of appropriate complementary feeding, which are the following. It should be timely, adequate, safe, and properly fed. Complementary food should be timely given at around age of 6 months, the time when nutritional needs of infants can no longer be fully sustained through exclusive and frequent breastfeeding. This is also the time when an infant would have attained good head control and truncal stability. So, also adequate to meet the energy, protein, and micronutrient requirements for growth. Safe, foods should be prepared and stored hygienically and fed with clean hands. Using clean utensils, not bottles and teats, to minimize risk of contamination with pathogens, and children should be properly fed using the child's signals of appetite and satiety with appropriate meal frequency and feeding method suitable for age. Some foods are more nutritionally appropriate than others to complement breast milk or formula. The food consumption patterns of US infants and toddlers demonstrate that almost all infants less than 12 months consume some form of milk every day. More than 4 months consumed more formula than human milk, and by 9 to 11 months, 20% consumed whole cow's milk and 25% consumed non-fat or reduced fat milk. The most common complementary foods between 4 and 11 months are infant cereals. Almost 45% of infants between 9 and 11 months consume non-infant cereals. Infant eating patterns also vary with up to 61% of infants 4 to 11 months consuming no vegetables. French fries were the most frequently consumed vegetables in toddlers. So this table summarizes the AAP recommendations for initiating complementary foods. So it is begin at 6 months. At proper age, a cup is encouraged rather than a bottle. One new food at a time is introduced. Energy density should exceed that of breast milk. Iron-containing foods are required. Zinc should be encouraged with foods such as meat, dairy products, wheat, and rice. Phytate intake should be low to enhance mineral absorption. Breast milk should continue to 12 months of age. Formula or cow's milk is then substituted. Give no more than 24 ounces per day of cow's milk. Fluids other than breast milk, formula, and water should be discouraged, and give no more than 4 to 6 ounces per day of 100% fruit juice. No sugar sweetened beverages. The WHO also set guidelines to address the nutritional needs of infants and young children, both breastfed and non-breastfed. However, this is only applicable in normal term, including low birth weight infants. So, guiding principles for complementary feeding include the duration of exclusive breastfeeding and age of introduction of complementary foods. So, as mentioned, exclusive breastfeeding is practiced from birth to 6 months, and complementary foods are introduced at 6 months while continuing to breastfeed. Although there is no significant harm with introduction of complementary foods at 4 months of age, and there is also no significant benefit from exclusive breastfeeding for 6 months in terms of growth, zinc, and iron nurture, allergy, or infections. Breast milk is sufficient to sustain the needs of growing normal full-term infant for 6 months. However, some micronutrients in breast milk is limited, such as your iron, zinc, calcium, and some vitamins, specifically vitamin A, riboflavin, B6, and B12. So, stores of iron in normal-term infants of healthy mothers are adequate and sufficient to sustain the iron needs for the first 6 months. Thus, there is very low risk of producing or developing iron deficiency anemia. However, low birth weight and those born to anemic mothers are at risk due to low iron reserves at hence iron supplements 15 milligram per day or 1 milligram per kilogram per day of elemental iron should be started at 2 months, and iron fortified or iron rich complementary foods should be started at 6 months. There is also low zinc content in the breast milk, though bioavailability is high. Thus, zinc supplementation from 1 to 9 months old is given in low birth weight with diarrhea, undernutrition, and liver disease. Vitamin deficiencies like vitamin A, riboflavin, B6, and B12 are uncommon among breastfed infants, except if maternal diet is deficient. What we can do is to have maternal modification of her diet or supplementation. Another guiding principle is the maintenance of breastfeeding. So continue frequent, on-demand breastfeeding until 2 years of age and beyond. Breast milk, when consumed in an average amount of 700 to 800 ml by 12 to 23 months, provides about 35 to 40% of nutritional needs. The high fat content of breast milk makes it a very good source of energy and essential fatty acids and promotes conversion of certain provitamins. It also provides 70% of vitamin A, 40% calcium, and 17% of riboflavin of a 15 to 18-month-old infant. Another is responsive breastfeeding. So this is practiced by applying the principles of psychosocial care. Successful introduction of complementary feeding depends not only on the kind of food being given, but more importantly, the manner, time, and the person who feeds the child. Active participation of the caregiver in feeding a child has been hypothesized to improve dietary intake. These principles include the following. So infants feed infants directly and assist older children when they feed themselves by being sensitive to their hunger and satiety cues. Feed slowly and patiently and encourage children to eat but do not force, harass, or be angry at them. If the child refuses many foods, experiment with different food combinations, tastes, textures, and methods of encouragement. Minimize distractions during meals if the child loses interest easily, and always consider feeding times as periods of learning and love. Talk to them and maintain eye contact. So, another is safe preparation and storage of complementary foods. Of course, practice good hygiene and proper food handling. Bacterial contamination of foods is a major cause of gastrointestinal infections in children, especially during second half of infancy, the period when diarrheal illness is at its peak. So, strict compliance with personal hygiene and proper food handling are important preventive measures. And one common bad feeding practice is the use of feeding bottles, teats, and pacifiers. These feeding gadgets get easily contaminated with bacteria, and it has been demonstrated that 35% of bottle nipples were contaminated with E. coli. So this is a clear indicator of fecal contamination. Clean cups, glasses, and bowls should be used instead. Foods must be cooked well, stored with covers and at safe temperature, and served immediately after preparation. Another is the amount of complementary food needed. Again, it is started at 6 months with small amounts of food, and the quantity is gradually increased as the child grows older while continuing to breastfeed. Higher energy requirements is needed because of higher resting metabolic rate for non-breastfed infants, periods of rapid growth in early infancy, high levels of activity, and during illness. A better gauge of adequacy of a child's food intake is the rate of growth reflected by length or height velocity. So the PSP-GHAN developed dietary prescription and food pyramid guide to assist on provision of appropriate foods for ages 0 to 18 years old. Another is the food consistency. Gradually and progressively increase the consistency and variety of food as the infant gets older, adapting to the infant's requirements and abilities. The consistency of food to be initiated will depend on muscular development of the infant. So it is started at 6 months with soft, semi-solid or pureed foods. Single ingredient foods introduced at intervals of 3 to 4 days are recommended to better detect food intolerance. At 8 months old, finger foods are started when munching and chewing appears. At 10 months old, lumpy foods are given. 12 months old, family or table foods. Also, avoid foods that may cause choking, such as nuts. Another is the meal frequency and energy density. Increase the number of times complementary foods are given as the child gets older. At 6 to 8 months old, it is given 2 to 3 times a day, and 9 months onwards, it is given 3 to 4 times a day. Snacks are foods usually self-fed and easy to prepare and eaten between meals and offered 1 to twice a day as desired. Food given more frequently than recommended is not advisable, as this could cause displacement of milk intake. For non-breastfed, complementary feeding 4 to 5 times a day with additional nutritious snacks offered 1 to twice a day would be appropriate. Another is the nutrient content. Meat, poultry, fish, or eggs should be eaten daily as often as possible. And for the micronutrient content, several nutrients such as iron, zinc, phosphorus, magnesium, sodium, and calcium are low in breast milk and need to be filled up in complementary foods. Plant-based foods are deficient in micronutrients, hence it is recommended to include meat, fish, or eggs as often as possible. Dairy products such as yogurt and cheese are good sources of calcium. Children with family history of allergy or food sensitivity should avoid cow's milk until 1 year of age, egg until 2 years old, and peanuts and other nuts and fish until 3 years old. Vitamin A-rich fruits and vegetables should be eaten regularly to prevent deficiency. For the fat content, which plays a several important metabolic functions and include provision of essential fatty acids, namely the linolenic and linoleic acid, formation of part of myelin sheath. It facilitates absorption of fat-soluble vitamins. It is also a source of concentrated energy amounting to 9 kcal per gram, enhancing energy density, satiety enhancer, and precursor for some important hormones. Diets should also contain 30 to 45% of fats for optimal growth. If animal fats are taken regularly, additional fats in the diet must be reduced to a minimum of 5 grams per day. Otherwise, 10 to 20 grams per day of fats should be added to the diet. For the protein content, recommended protein intake for 6 to 12 months old is 14 grams, and for toddlers 1 to 3 years old, it is recommended to give 28 grams of protein. Besides potential for milk energy, cow's milk has also high content of protein and minerals such as your sodium, calcium, potassium, and phosphorus, which has the potential to increase renal solute load. Hence, the cow's milk protein content of 1.45 to 1.6 grams per DL has been modified to approximate that of human milk, 2.9 to 10 grams per DL. Cow's milk whey to casein ratio is 18:82 has been changed to closely mirror that of human milk to 60:40. Whey protein in cow's milk is predominantly beta-lactoglobulin, and human milk is predominantly alpha-lactalbumin. Also, beverages with low nutrient value. Coffee, tea, soft drinks, and sugary commercial beverages are not recommended. This may satisfy the appetite of children but are devoid of proper nutrients for proper growth. AAP advised limiting intake of fruit juice to only 240 ml per day. Use of vitamin, mineral supplements, or fortified products for infant and mother. So, because the quantity of animal source food that can be consumed by infants may be insufficient to meet the needs, two alternatives may be adopted, which is food fortification and vitamin mineral supplementation. Food fortification in the home may be achieved by mixing products that contain concentrated amounts of vitamins and minerals like sprinkles, crushable tablets, or fat-based spreads to foods prepared at home. And fortified food lessens the need for the infant formula. And to ensure adequate calcium and vitamin B12, milk or milk products and animal and animal food source should be given. In cases of malnourished mothers, vitamin mineral supplements or fortified products are given. A single dose of 200,000 IU vitamin A after delivery, not later than 6 to 8 weeks, supplemented with thiamine, riboflavin, vitamin B6, vitamin B12, iodine, and selenium is necessary as the levels of these micronutrients can easily be affected by maternal diet. Folate, calcium, iron, copper, and zinc remain relatively high in breast milk despite low maternal reserves. However, supplementation is still recommended to protect maternal reserves. Also, feeding during illness, increased fluid intake during illness, including more frequent breastfeeding, and encourage the child to eat soft, varied, appetizing favorite foods. So during illness, the need for fluids is higher than normal. Sick infants appear to prefer breast milk, thus frequent breastfeeding is recommended. Even though the appetite is reduced, continued consumption of complementary foods is recommended to maintain nutrient intake and enhance recovery. For non-breastfed who refuse quantity of water needed, it is necessary to restrict foods high in renal solute load during illness such as fish, cheese, chicken, beef, and liver. The positive changes in the last decade include increased duration of breastfeeding, delayed introduction of complementary foods, and decreased juice consumption, and continuing concerns include lack of fruits and vegetables, diets low in iron, essential fatty acids, fiber, and low grains, and diets high in saturated fat and sodium. That would be all for complementary feeding.